Hi, today we have a leading expert in the world of beauty and healthcare who has revolutionized the way we approach reverse aging. That's right, no Botox, no fillers and no invasive therapies, but the natural way. We have with us today Dr. Ilan Karavani with 40 years of rich experience. He has started with Reyu, the natural way of self-healing and reverse aging. If you could tell us more about yourself, your past experiences, and how you came up with this new technology, the natural way.
Well, it took a long time, as you mentioned, 40 years. I started in 1984 with interest in everything that has to do with skin, health, and beauty. And in 1984 already I had one of the first CO2 lasers in my hands. And then I switched to an internship in plastic surgery under the leadership of Professor Franz Segers. But after a while, I didn't like it too much because it was very invasive, and I saw let's say, the relationship between the inside of the patient and the outside of the patient. And with plastic surgery, we didn't have attention for that inside part. And they didn't look really natural. They looked like this wind tunnel effect when the skin was pulled.
Right.
So at that time, a new branch started from America, what we call the dermatological surgery, which was less invasive. And we started to investigate new technologies. And soon after that, the injectable started. In the States, first in '87.
Right.
In '87, in fact, is the year where everything turned around. The first Botox was published by the Carothers. I went to study it from a Texan doctor, James Fulton. And the first collagen injections came out. We had cocaine with Zyderm, Zyplast.
Right.
Everything started about then. The threads started about then. The peeling started about that time. The softer peelings, I mean, because the heavier peelings, phenol existed before that. So everything was starting to boil in the world of aesthetics and healthcare in the softer way. What was before is hardly practiced anymore.
Right.
So my career started when this branch started, which is amazing. Shortly after I finished, I opened my own clinic. And 2-3 years later, they asked me to become president of the Benelux Society of Surgery, which I accepted with a lot of honor. And I brought also the World Congress to Amsterdam in '97.
Yes, read about that.
Yeah. So we also created a course, a university course of 2 years for cosmetology. So a real university degree for cosmetology to answer to all those regulatory questions of cosmetics that are now very well regulated.
Right.
And they used to be totally non-regulated before '87.
Correct.
So you see, a lot of things started boiling at the time, and I was a pioneer of all that. And at that time, as a pioneer, you could do something. You could change things. And this is exactly what I did. And slowly and gradually, we injected, and we did a lot of things, even natural stuff, like we injected also autologous fat, so fat that you derive from your own body and you inject in your face with stem cells, etc. You couldn't find anything more natural than that.
Correct.
See? But despite all these evolutions, by the time I got like 2012, we saw the faces of our patients change.
Yes.
They were not the same anymore.
Yeah.
They looked odd.
Correct.
And I called my colleagues in Hollywood, which I knew from the congresses. I went to see them, and they told me, look, we stopped injecting. We stopped injecting Botox to disconnect the nerves from the muscles. We stopped injecting hyaluronic acid fillers because these faces don't look normal anymore.
Absolutely.
And at all the congresses we learned that the fat pads in the face are losing their volume. And as they were losing their volume, we tried to correct it with hyaluronic acid or with your own fat. And by 2013, my daughter got married with the son of a famous radiologist in France.
Okay.
And they had a very big clinic with CT scans. And we started to analyze what's happening inside this head of us with aging. And surprisingly, what we found on all these CT scans is that we lose muscle. We lose the volume of the muscle.
Right.
And because the muscle doesn't pull anymore on the bone starts to shrink.
Correct.
So we had major changes inside the face, which are muscular and bony, because this muscle didn't work. When we went to see on research how to regenerate the muscle, we found out that stimulating the muscle will not solve the problem.
Okay.
There is only one organ that stimulates the muscle continuously, which is the brain.
Right.
Because it is with us day and night, 24/7, all our life. And it fires its commands through nerves.
Right.
And these nerves are very sophisticated cables, because not only they bring the information to the muscles, they also bring information back to the brain to adjust itself. And it is these connections that we block with Botox.
Right.
What we call receptors.
Right. It's important. It goes from nerves to muscles to the brain. That's how the communication is.
Yes. Through receptors and synapses.
Right.
So the brain has to take care of the muscle and keep him alive day and night. We've got, like we call, a muscular tone. Even if we're not contracting voluntarily, we still have a tone. That's how our posture is there.
Right.
Okay.
Right.
Without that tone, we would fall on the
sit.
floor. Yes. And when it's too active, we get these involuntary contractions. But when it's too loose, we get loss of volume of the muscle and loss of tone.
Right. Right.
So working on these nervous connections was in fact the next step to take.
Lovely.
You see? And that's how we came to tests with electro-modulation that have been done like 100 years before.
Yes.
So we understood it's the way, but we have to reinvent it totally.
Right. For example, I think in 1922, Hodgkins and Huxley's theory of electrocurrent on the intercellular...
Yes, in 63, they got the Nobel Prize for that.
Lovely, yes.
Where they explained how the body is electric.
But also after that, the big pharma industry came in and...
Well, we had from 1922 till 2003 a whole evolution in electromodulation. So what happens with aging is a lot of loss of connections between the brain and the muscles in the face. I'm talking more specifically on the face.
Yes.
So we age in a specific way, and we start becoming older and older. All the techniques that we have till now do not reverse aging.
Okay.
We still continue to age. We still continue to lose our muscles, and we still continue to lose our bone. What we create with the techniques of now is an avatar of our face.
Right. Okay.
Like another face that is maintained with technologies that are not related to our own self-healing. We bring in hyaluronic acid, which is not the muscle.
Correct.
Even if we bring in autologous fat, which I did a lot, still not the muscle. Autologous fat cannot replace your muscle, cannot correct your posture, cannot pull on the bone to recreate the bone. Okay? We bring in botulinum toxin, like we call it, to disconnect the relationship between the brain and the muscle, because the brain cannot, it fires, but the muscle cannot relax completely.
Okay.
This is not the way to do it. We understood now that rearranging the wire, which is the nervous connection, gives you a relaxation of the muscle like a baby.
Right.
So disconnecting the nerve from the muscle is not how the body works. Of course, we will not see this involuntary contraction of the muscle and these wrinkles. But on the other hand, we will lose our expression, we will lose volume of the muscle, which we need, and subsequently we will lose volume of the bone. You might even do a lifting, which is never totally vertical, never dynamic, never muscular, never affecting the bone, so it's not really correcting aging. You do some lasers to tighten the skin, but it's not a tight skin that we need. We need a correct shape, because shape determines our age. A baby who frowns is still a baby, and a person who is an adult, 60, 70 years old, even if the skin is smooth, he looks his age. So we had to go to a totally different world. And because we age more and more, eventually we will have a face that looks different.
Correct.
And with different, I mean, it will look at best aged, and at its worst, funny.
Yes.
And we see them.
Yes, of course.
We see them even in Hollywood with all the means that they have. We see they have these funny faces. All the accumulation of things that you did in the past, because hyaluronic acid doesn't leave the body, it stays in the face, it attracts water, and after a while we get this swelling, which we already call the pillow face.
So continuing with this same topic, Botox is different from fillers.
Yes.
And what people usually, when they go to a cosmetologist or a dermatologist, they are usually told that it paralyzes the muscle. But I understand from what you are saying is basically it's the nerves, the connection and the communication between the nerves and the muscles.
Yes.
And fillers can be reversed, but Botox cannot. And that's why we see a lot of experts who are in this industry, even with Hollywood, Bollywood actors and all biggies, the treatment, most of the treatments, it goes wrong. The faces look funny, the shape of the face changes, and it's amazing because even the fillers, although they say it can be reversed, it just moves around, right? It does not get reversed completely, or you cannot remove it completely.
Botulinum toxins in the industry now, they're derived from the same bacteria, and they extract it as a powder, and this powder is dissolved in physiological water and then injected, and it's the number of units in the vial that is determining what we get. So let's look at what really gives us the shape of our face, which are the muscles. And we try to neglect it and to discard it because we don't want to hear about it, because till now there was nothing that we could do on the muscles. With aging, these nerves, they become dysfunctional and they don't fire as fast. So the information doesn't go back and forth very quickly, which has a lot of consequences. The first consequence is when a child contracts his muscle, it can immediately fully relax its muscle. This is not the case for an adult person. He stays with an involuntary contraction, residual contraction of the muscle, because of the lack of speed. The natural way to correct it is to enhance this cable, repair this cable that we call the nerve, and restore the speed so that you can relax fully after each contraction. What we do now with botulinum toxin, we cut off the communication at the level of the muscular nervous connection, the synapses as we talked, and that means there is no signal anymore to the muscle, so the muscle relaxes, but it has also no signal to keep him alive, and he starts to shrink slowly, and when he shrinks slowly, your facial shape changes. It doesn't pull on the bone anymore, so your bone changes. All the other muscles starts to work to compensate. You get a funny face. It's not really a good solution.
Yeah.
Definitely not on the long run.
Right.
And what happens further is, with the further atrophy of all this, people become insensitive to Botox
Correct.
or botulinum toxin.
Yes.
You hear that more and more.
Right.
More and more, my Botox didn't work.
Oh, yeah.
I injected and it doesn't. I'm allergic. I'm resistant. I'm
Yes.
this. Okay.
Yes.
It doesn't stay so long by me anymore, and things
Correct.
like that. This is because we abuse of this whole thing. Okay. Good. That is number one. Then, because these nervous connections don't function well, we lose volume in the muscle
Right.
because it's not activated. If you don't activate your muscles, you will lose the shape and the volume of your muscles, which means you will lose the shape of your face.
Right.
And that's the cause for aging faces. Okay?
Okay.
So you don't have that volume anymore.
Right.
Then, of course, you will not be able to pull on the bone. The bone will add to this loss of shape. Okay?
Right.
So, and then you get the shape of your granny. Okay? Shape of your grandmother. Why? Because it's a different shape, bony and muscular.
Yeah.
What to do about it? The logical way is to reactivate the muscle.
Okay.
So that means repair the nerve, activate the muscle, which will pull on the bone and reactivate the bone.
So which means it is possible if a client has gone through Botox and fillers and they are not happy because it cannot be dissolved, you can reactivate the muscles. Okay.
Of course you can reactivate the muscle.
Okay.
Now, the third thing that happens is our tone, our muscular tone, which lifts our face and the corners of the mouth and everything, is not there anymore.
Right.
So we start having the face that drops down, okay? And pulling it up with threads or even lifting is not a physiological thing.
Okay.
Because what is a real lifting? A real lifting would be vertical.
Correct.
A real lifting would be muscular. That means your muscular tone is active.
Right.
A real lifting would be dynamic. That means, you can move your face, not static.
Correct.
And a real lifting would affect also the bone and the bone volumes. So now, with the technology of electromodulation of Reyu, we start to perform these type of liftings, which means vertical, dynamic, muscular, and bony lifting.
Okay.
And we see people regain their face of when they were 20.
Interesting.
You see, they recognize themselves in what they were 20. While if we work further with injectables and botulinum toxin and threads and lasers, you will get a face where you don't see many wrinkles, but you put your face when you were 20 and it's a different person.
Yes. And we've
And
seen
a
that.
funny person.
Yes.
And sometimes even an ugly person. Okay?
Surely.
And as we live longer, we don't want to go down that path.
Correct.
Now, when we're talking about correcting, hyaluronic acid, once injected, it has two changes
Okay.
that it's succumbed to. First of all, the viscosity. That means the firmness of the gel
Right.
diminishes.
Okay.
We call it the G prime, okay, the viscosity. So you put like two prominent here zygomatic arches, and then what happens a few months later, the prominence is gone
Right.
because the G prime is gone and the viscosity is gone.
Right.
And then it starts to migrate around the face. By movements, it starts to migrate. The viscosity also changes with movement. So it's there in your face, but it's not exactly there where you put it.
Right.
And then you come to your doctor and you say, "Doctor, I think it's gone. We need to re-inject." Until very long, doctors and patients believed that hyaluronic acid dissolves and that we absorb it.
Exactly. Yeah.
But it's not the case. Enough studies have proven now that your hyaluronic acid of 20 years ago still remains, but it
Wow.
has moved.
Okay.
After a while, you've got so much hyaluronic acid in your face, and your muscle is going down, down, down in atrophy, and you get more hyaluronic acid nearly than your muscles, and you start to have a very funny face because hyaluronic acid attracts water. You get this bloating face, what we call now the pillow face. Famous actors like Tom Cruise, like Madonna, like many others. I mean, like 30–40% of them have this puffy face.
Absolutely,
Now you say, let's remove it. And yes, we can. There is a substance called hyaluronic acid dissolver, which is hyaluronidase. When you inject it, it dissolves the hyaluronic acid. But because it migrated, you have to do that under echo. It's very difficult to find it. Removing hyaluronic acid, it's 10 times more expensive than putting it. And it goes slowly and gradually. And it has a serious side effects because when this hyaluronic acid dissolves in your bloodstream, it can react with your immune system and create what we call autoimmune diseases, which can be very invalidating. You can end up in a wheelchair. And it happens to 20% of the people. So, which means that it's a big danger. Not your first ml, but when you inject 30, 40, 50 milliliters over the years, you will surely have it. So it's a time bomb ticking for all of us. Hollywood started first in injecting a lot, so they stopped earlier because they understood it's not possible and they got these funny faces earlier. Now, India is not very much a country of hyaluronic acid and Botox, but if you look at middle of Europe, where you have these very slim faces, they will have it eventually. It will take time, but they will have it. And we see now in movies, or even in Netflix, all these actors and actresses without anything. If you look at the latest movie of Julia Roberts on Netflix, if you look at the movie that is called Youth with Jane Fonda, also very wrinkled. If you look at the Ozarks, the series The Ozarks, I mean, all of them. I can name them from the beginning till the end, but then I would be listing you Netflix here of all actresses between 45 and 60, and there is no solution.
Even you've seen that, and sometimes you get amazed at how come, they've not even touched their face.
Because they cannot.
In this episode, we spoke about the side effects of Botox and fillers and why you should not go for such invasive therapies. Instead, replace it with new technology called electro-modulation, which is much safer, much better, and works better than any Botox or filler. In our coming episodes, we are going to talk much in detail about electro-modulation and also speak on where do young people get their beauty from. So stay tuned and subscribe us for more.